which is the other one, please, if you wouldn't mind first, the Georgia one. Thank you. So, Doctor, while we're on break, before we get to the other study regarding that just came out today, I want to go back to the Georgia study that you mentioned in your direct examination. You still there? I can't see anymore.
Yeah, I'm here.
Okay. 1 second. It just, for some reason, it reshuffled all my windows. Okay. So this study that you mentioned before, would you mind scrolling down for me, please, to the results section? A little more up. Okay. It says right here, and for the record, I'm referring to again what is Plaintiff's Exhibit 66. My understanding was in direct examination, you said that even though you disagreed with some of the issues, that one of the things you said was in this study, the campers and staff didn't use mitigation or proper mitigation. Was that what you testified to?
Yeah, that's what I don't know if it's in this text, but the news reports around that around that situation suggested that was the case. That they were singing and yeah, that sort of thing.
Well, I'm reading here. This is in the findings sections, and it says these findings demonstrate that this is the top of the paragraph, right where the icon is. These findings demonstrate that the SARS-CoV-2 spread efficiently in a youth-centric overnight setting, resulting in attack rates among persons in all age groups, and I emphasize this, despite efforts by camp officials to implement most recommended strategies to prevent transmission.
Yeah, it's when I understand that actually didn't happen, that at the camp, that there was actually not a lot of, especially in the places that they found the transmission, that there wasn't a lot of compliance with those orders or with those suggestions. The other thing, the study, if you scroll down, you'll see the limitations of the study. They say that they can't rule out that the people came into the study came into the camp with the disease.
And I remember you testifying to that, but I want to be clear. I don't know what news articles you're talking about, but here actually in the study, it says they followed most of the recommendations for strategies to prevent transmission. So that's what the study actually says. Is that correct?
Can you point out to where you're reading that? I don't have a recollection of it saying that.
So I'm sorry. It's the yeah. There you go. That's the first.
Can you scroll down and let them read the entire paragraph, please?
Sure. Would you mind doing that for me? There we go.
Yeah, so relatively large cohort sleeping in the same cabin, engaging in regular singing, cheering. That's where I got that idea from. I mean, it says that right below where you highlighted.
I understand that. But
I mean, was not universal. This is consistent with what I said. So the use of cloth masks is not universal. They slept together, slept close to each other. I mean, I'm not sure why you're saying this contradicts what I said. It says completely consistent with what I said.
Well, you said before that they failed to follow most implemented recommended procedures, which
regular singing and cheering is not a recommended procedure. I wouldn't recommend singing and cheering. I mean, we know that those cause spreading events.
Okay, let's go to the new, if you wouldn't mind, Scott and Josie, to Exhibit 67. And can we scroll down to page 3 to the conclusion and results? It's actually the page 3 of the actual document. So it'd be page 5 of this attachment. Thank you. Now, Doctor, we took a brief recess to allow you to review this report. This is a report that came out today from the Academy of Pediatrics. Did you have an opportunity to review this report during lunch?
I did, yes.
All right. And this report this report, which is peer reviewed and has not been formally released, much like the report you mentioned about the mortality rate, this one actually says something very different. It says that children can transmit the COVID-19
No, it
virus.
doesn't say that.
It
It
doesn't
says,
say
no, it
that?
does not. Well, here's what it says. This is similar to a study that was in JAMA Pediatrics 2 weeks ago, I think, and also in March, I think there was a study out of Germany that found something similar. But what the study says is that if you look do a nasal swab of children, you can find viral particles. It doesn't say that the children are infectious. That's a different question. So when you have an immune response to a virus like SARS-CoV-2, you often get, after you've had a successful immune response, you may still have non-viable viral fragments still present. The study doesn't exclude that. In fact, none of the studies that are like this isn't the newest one or the first one, determine whether those viral particles are actually infectious. In order to do that, you need to do studies like the contact tracing and the genetic analysis that we talked about in Iceland. This study doesn't do anything like that.
Well, let's go down to page 4, if we could, please, to the second complete paragraph. And would you highlight the first sentence, please? Doctor, I want to read this to you because it seems to be slightly different. It says, the manner in which children contribute to the spread of the SARS-CoV-2 is unclear. Children are less likely to become seriously ill from SARS-CoV-2. However, asymptomatic carriers, including children, can spread infection and carry the virus into their households. So again, I want to ask you.
The article is speculating at that point. They're not talking about the results. They're saying, well, let's think about what this means. And they're saying this could mean that. But we have evidence on whether it actually means that from Iceland and other places that I've cited. This is, I said, this is not a new finding. There's several other studies that have found viral fragments in the noses of kids that have the disease. Several of the studies suggest that they're less efficient at spreading those viral fragments. And as I've cited the Iceland and other evidence, they don't cause, I mean, it's very, very difficult to find evidence of that spread from kids to adults. It's possible that they spread it to kids. That's absolutely possible. I mean, I'm not saying they play no role in the transmission. That's not what the scientific evidence says. It's that they play a much smaller role than you would expect, even zero, in spreading the disease from kids to adults. This could be non-viral fragments. They say that here in the study, in the limitation section. Then they're right to say it. They don't know that it's infectious. They're speculating at this point in the article. This is an interesting article. I mean, it confirms several other articles that find viral fragments in the noses of kids that have some history of the disease. That's not the same as infectiousness.
Well, doctor, I want to ask you this because it just, we're all entitled to our own opinions, but your official position as a tenured professor at Stanford is you're saying that this article does not represent children can transmit the COVID-19 virus.
I'm saying that if you want to conclude that, you need more evidence than this article presents. That is my opinion of this article.
Okay.
The authors agree with me. They say that essentially in their limitations.
Okay, you can take this article off, and then, Your Honor, at this time, I'd like to move that article, Plaintiff's Exhibit 67, into evidence, please.
Are you moving 66 also?
Yes, Your Honor, the Georgia article as well.
All right, any objection to plaintiffs 66 and 67?
Oh, Your Honor.
Okay, both 66 and 67 are admitted.
I want to go back now. You mentioned before on direct examination that you found that this type of decision about reopening schools the decision shouldn't be cast as such a wide net. Is that correct?
I don't understand the question.
It shouldn't be made on a high level. I think my notes actually said that you said that we should be making these decisions.
Yeah, we should consider local conditions. That's what the WHO and CDC guidance says.
And let me ask you this: if a child does get COVID-19, are there potential long-lasting effects of the virus?
It's possible.
And what
is still emerging?
But the emergent evidence that we have at this point, what are some of the long-lasting things that children can get from COVID-19?
I mean, this is true of every virus, every common virus. Like it's true with the
That's
flu.
not what I asked, doctor. I asked you from COVID-19.
I think that
What
with
can children-
COVID-19, what I've seen is that there's some evidence of a unknown fraction of kids, probably very small, getting some long-term consequences. Like for instance, there was a paper in Lancet on Kawasaki's like syndrome, where in my calculations, I think it was like 40 some kids in Italy identified as having potentially linked to SARS-CoV-2 infection, this autoimmune disorder. There are other things like that. That in general, the evidence is emerging and suggests it's relatively small number of kids. And as I said, the mortality rates were very, very low. This is the same danger the flu you see with the flu, you see with a host of other childhood viruses. A small fraction of kids, it's a deadly virus.
Well, even if we disagree about how it affects children, you would certainly agree that this virus is very different for the flu for adults, right? In terms of
I've said that it's more deadly
mortality.
than the flu for adults over 65, less deadly than the flu than for kids under 18.
So if teachers were to go back to school, like some teachers are already in school in Florida and some have to go back tomorrow and next week, even if a teacher, doesn't pass away or die, are there long-term effects they could suffer from COVID-19 as well?
Yeah, that could happen. Absolutely.
And what are some of those long-term effects? Like specifically, what are some of the conditions they could have long-term because of the COVID-19 virus?
I mean, I've seen some evidence of myocarditis. I've seen some evidence cited of neurologic symptoms. I've seen some evidence cited of strokes. Those could happen as a consequence. That's absolutely possible.
What about issues with someone's?
Let me just say, just finish. So the question on that literature, and it's interesting. It's really important. It's certainly worth further investigation. But the literature up to now has it makes no real good numbers on what the rate we should expect those long-term sequelae.
Right. So if we don't know what the numbers are, doctor, shouldn't we err on the side of caution and protect people from having long-term strokes, neurological issues, cardiovascular issues, respiratory issues? Shouldn't we want to protect citizens versus trying to open the economy too quickly if we don't know?
I think you have to ask that question for grocery workers, for police workers, for firemen, for all kinds of folks. You want to know that they also face those risks. These are essential employees. The question is not, do I just look at one risk? I consider the panoply of things that could happen that happen when you close schools, and ask, what are the whole range of risks? It's a risk, and then you take mitigation steps to address those risks as best as possible. There's no riskless option here.
Well, no, I agree with that, but you would agree since March, when you wrote your first Wall Street Journal article and you first started on March 9th in Santa Clara, working nonstop fully on the COVID-19 pandemic, that there are certain things that have changed as we've gotten more knowledge about what's going on, correct?
That's correct.
Right. So we could get a new report tomorrow, just like we did today, that we may disagree on what it means. And that's for the judge to decide, but ultimately they could show that there are a lot more long-term effects than we're thinking.
I mean, you have to make decisions based on the evidence you have in front of you now.
Right.
I've summarized my view of that evidence.
So going back to that, there's 67 counties in the state of Florida. Have you had the opportunity to review each of the 67 counties' plans to reopen brick and mortar schools?
I've reviewed a subset of them, but not all 67.
Which ones have you reviewed?
I'd have to look in my records. I think it was Broward, Orange. I saw some report there, and then a few others, but I forget exactly.
And were you consulted by the governor's office before this lawsuit to aid Florida in its reopening procedures?
No, I was just reviewing it after the fact.
So you were brought in after there was a lawsuit filed to help essentially provide evidence on behalf of the governor's office. Is that correct?
I mean, I was asked to provide evidence, provide my view of the science on children. Yeah, that's true.
But not just children. I mean, but is your testimony that you're not here to provide any advice on or any expert testimony about teachers, bus drivers, administrative assistants, anything like that? Or
No,
is it
I mean, I can talk on that. I mean, so if is your question, is it possible to have those kinds of activities?
no,
Litigation? I don't
compound
necessarily
question,
follow the
forgive me.
question.
Hold
Sorry.
on, doctor.
Yeah, hang on just a second. No, you can't both talk at the same time.
My
I understand.
apologies.
Thank you, Judge. I'll be better about it. I want to ask you precisely. You were brought on, as we talked about, after the lawsuit had been filed, the lawsuits, correct?
I mean, I'm not sure of the timing, but I mean, that's possible, yeah.
And you testified before, and just we were having the back and forth, that you can testify about transmission of the virus between teachers at work or bus drivers or administrative assistants, correct?
Are you asking me if I can say something about that transmission rate?
Well,
I mean, I'll testify.
right, meaning that adults can transmit the virus to adults, correct?
That's correct. I've said that, right?
Right. Well, I'm not. I want to be sure because there's been a lot. Adults can transmit the virus to children. Is that correct?
Adults can transmit the virus to children, and adults can transmit to adults. That is correct.
And your position is that children cannot transmit the virus to adults.
They transmit the virus to adults at much lower rates than I mean, basically vanishingly low. Yes.
Going back to this idea of local decisions, you feel it's up to each local county. They should have the ability to decide when it's appropriate to open their schools brick and mortar, right?
No, I think you account for local conditions, but who makes that decision is not up to me. That's a question of sort of state and local county relationship between governments, and that's a different question. The question of whether local conditions should be taken into account, yeah, absolutely. I think they should be taken into account.
And can we agree, much like Stanford has not had children come back for a certain period of time, that would you agree that at a local level, that teachers who suffer from very serious pre-existing conditions like quadriplegics or people with serious heart conditions should be allowed not to return to work and not suffer penalty for that?
I mean, my heart goes out to people who are in that situation. They're facing very, very difficult choices and difficult decisions to make. And I think if you're asking me as if I were a policymaker, or are you asking me as a scientist?
I'm asking you, yeah, if you were advising a policymaker like you're doing in this case, providing expert testimony, what would be your recommendation?
If you're asking me as a policymaker, I would be in favor of making some kind of accommodation or training or some sort of mechanism to protect those folks. But that's I mean, I'm not a policymaker, right? So I'm testifying as a scientist.
Right. And you're aware, though, at some of Florida's schools that I'm sure are big and large, like some of California's big schools, there can be hundreds, if not, 400 or 500 adult staff members at schools at any given time. Are you aware of that?
Yeah, I'm aware of that. I mean, I think this is the same. And again, you're asking me as a policymaker. This is the same kind of dilemma that every essential business had to think about. How to continue to be able to perform the activities that are absolutely essential to society, while also to the best possibility protecting the employees that are performing those activities. I don't think schools in that sense are fundamentally different, except in one sense, that the clientele they have, which children, pose much less a risk to them than many other clientele that essential workers interact with, because children don't pass the disease to the adults.
You would certainly agree, though, like Stanford University or Harvard's doing, even though it's not as good as in-person learning, you can do learning over the computer or over some telecommunication device.
I mean, I taught 2 classes online last spring at Stanford. I mean, I've been teaching here for 20 years. I did my absolute best. I think I did a good job, but my students seem to like me. But I'll tell you, I feel like I did them a disservice. I could not have the same kind of educational opportunity for them that I wanted to offer them. It's not a substitute. It's not perfect. It's not close.
Right, and I understand what you're saying, but unlike, you theoretically a human being, you're talking about essential services, theoretically a human being can go a year without learning in school, but they can't go a year without eating sustenance, like from a grocery store. So you would agree there is a difference between someone providing food in a
I
food
think
chain.
I think schools are essential. If you're asking me a question, how essential schools are, I think they're essential to human functioning and human vitality. The evidence in health economics suggests that even missing 1 year of school can have long-term negative health consequences. So it's and including mortality, lower life expectancy, and other outcomes. I don't think that if you're asking me, do I think schools are less essential than food? I mean, okay, you don't survive without food, but what's life without the education that we're
Well,
providing?
there's no question that you have a point that in-person learning is better. No one on the plaintiff side is debating that. The question is, and what this whole lawsuit's about, as you know, is when we allow schools to be back in person. So I wanted to clarify your testimony. I'm going to ask you again because you got a narrative answer there. That I want to differentiate. You made a comment before that it seems like it bothers you that police officers, doctors, nurses, grocery store workers, they have to go to work. Why shouldn't teachers have to go to work?
Oh no, it doesn't bother me at all in that sense. I mean, I think they're doing activities that are consistent with their calling. I mean, that's why they chose those professions. They're serving the people that they have dedicated their life to serve. I think that I mean, I don't. It's not a question of bothering me. I wish you wouldn't put my words in my mouth about that. That's not true. I'm not bothered by it. I think that we should consider all the costs and benefits of these. If you're asking me as a policymaker, which I'm not, we should consider all the costs and benefits comprehensively when we're making these decisions, not just looking at one risk at the exclusion of all the other costs of taking an action.
I understand that, and I understand you're not a policymaker, but in your lengthy opening about your curriculum vitae and everything you do, health economics, from what I gathered, and correct me if I'm wrong, is a balancing act of preventing the spread of disease that can hurt or kill the population, and on the other side of the equation, balancing a standard of living and all the economic and standard of living questions that go with that.
And health
Right.
questions, right? So it's not, so suicides are up. It's not simply a question of standard of living. It's a question of life. It's lives versus lives on both
Right.
sides of this equation.
Well, and I think that's where we differ, and that's why I want to end with this. From what you're saying is, if we were to think about this, and this is from, you've been at Stanford since 1990 studying, whether it's PhD, medical, and all this research, except for, like you said, the few years at some think tanks. It really comes down to this from your position and your advice to the governor and the defendants in this case, that your opinion is, in a balancing act, if the lives we may lose from opening schools is outweighed by the need to open in-person learning.
I mean, I don't think I would characterize it simply that way. I'd say we want to take careful action to protect the teachers. We want to take careful action to protect the interests of the students, and to provide them with the best education possible. I think all of that needs to be taken into account, including local conditions in making these decisions. That was why I would argue.
And we can agree about making sure we protect teachers. Your Honor, at this time, I have no further questions for the doctor.
Redirect.
Briefly, Your Honor.
Judge, if I may, I represent several parties too, and I'd like to have an opportunity to cross-examine this witness. I'll do everything I can to avoid duplication.
Yeah, you may proceed, Mr. Coffey.
Thank you. Doctor, is it true that you know who Dr. Deborah Birx is, don't you?
Yes.
And,
Well, I don't know her personal, but yeah.
okay, but you know who she is, and she is in fact the head of the White House task force on COVID. Is that right?
I don't know if she's the head or what. I didn't follow that closely.
And were you aware of the fact that she said publicly, actually on CNN, that she was asked about whether schools in areas with 5% positivity rate or higher need to use distance learning? And the questioner, Dana Bash, was referring to a statement that had been made by Robert Redfield, the CDC head. And she said, I certainly would endorse what Dr. Redfield is saying. So are you aware of that?
I haven't heard her say that. I didn't see that CNN. I don't tend to watch much TV. But I'll say that we saw what Dr. Redfield said. He didn't say 5%. He said 5, 10. This is a rough guide. I mean, he didn't say that.
Well, Dr. Birch did say that. She was asked about 5%, and she said she would endorse that. I mean,
You said, it sounded like you said that she endorsed what Dr. Redfield said. He didn't say 5%. He said 5, 10. You have to take into account lots of things.
well, she asked about, I think she was asked about the 5%. Have you heard do you apply a different metric than the 5% positivity that you think assures student safety?
I think that 5% number is an arbitrary standard that's not connected to student safety in one way or the other. That 5% could or could not, for reasons I gave in my testimony, may or may not indicate whether it's safe. You have to look at a much broader set of facts before you decide something like that. And it can't just be one number.
Yeah, my question is, do you use a different metric? It's just, do you have a different objective standard that you use in determining school safety? Or is it your testimony, there is none?
That's not my testimony. I mean, I think I just gave my testimony, right, Mr. Coffey? So I said that there's you have to look at a whole panoply of things and not simply one number. I mean, I could get into what you want, what sorts of things one might look at, but again, it's going to depend on local conditions.
Okay. Well, is 10% positivity the number you think that should be?
I'm sorry. Please go ahead, finish.
Well, that's my question. Should it be 10% positivity?
Yeah, so I don't think looking at a single number is going to give you the answer to that question. That was my testimony, and that what you're trying to get me to pin down to one single number I think is a mistake. I think we should look at a whole set of range of facts, including community spread, not necessarily measured in this biased way, but as a whole. Are hospitals in the area at risk of being overrun? Are children really being infected at high rates? Are they dying at high rates? Those kinds of things are important to look at, but it's within the context of a whole range of things to decide the safety of the epidemic, not simply one number where you say one threshold. Is 4.9% safe? Is 5.1? I mean, you can see the problem with one single number, especially for a biased metric, where it doesn't actually measure community spread. Well,
let me ask you this. You are familiar with the submission by the Florida chapter of the American Academy of Pediatrics. You're familiar with that submission, correct?
I think I've read that, yeah. Okay,
it's Plaintiff's Exhibit 8. I'll ask you some questions from the document. But would you agree that, as you already acknowledged, you've never treated a patient in the state of Florida? Is that correct?
That's correct.
And you also know, because you read about it, that Florida has been described as ground zero, actually one of the worst states with respect to the COVID virus infection. You're aware of that, right?
Well, I've been tracking the rate of infections and deaths, and you guys have done better than New York and New Jersey and Massachusetts, for instance, in terms of deaths per million.
How many people are dying each day in Florida about?
I didn't check the numbers this morning. I can go look.
Usually at least 200, isn't it?
I'd have to go look this morning. I can check while we're talking.
Yeah, check while we're talking. And the number of total COVID rates, cases, have we reached 600,000 yet?
Let me take a look at the latest numbers. Yeah, so 582,000 residents have had COVID in Florida as of today.
Okay. And I was a little confused. I couldn't say if you were denying that the World Health Organization had recommended a positivity rate of 5%.
Yeah, I actually had a chance to review that document during the break. That document doesn't say that you should use 5% as a standard.
Okay.
What that document says is if you want to measure, you should take into account the R0. So what is R0? R0 is the rate at which the infection epidemic is growing. And it says that you may be able to use that statistic, the test positivity statistic, as evidence about R0 if you have a sample of people that's representative of the population.
Okay. Well, let me...
I've already testified. I don't think that you have a sample of people representative of the population.
Okay. You think the positivity rate is just not that valuable, correct?
No, it's a part of the set of things one looks at. You have to think about what that number actually means rather than just going robotically with some standard, that number means that among the set of people that are tested who were positive, how many test positive.
Mhm.
That's different than whether the disease is spreading, increasing or decreasing. What
Okay.
that World Health Organization document says is you should look at whether the disease is increasing or decreasing to decide if you've controlled. By the way, that document is not about school opening or closing.
Okay, well, let me read your document that is. This is the exhibit we were talking about, Exhibit 8. It's the submission from the Florida chapter of the American Academy of Pediatrics, and I'll read it to you. It's really found in the second paragraph. The World Health Organization has recommended that the new positive rate for SARS-CoV-2, which causes COVID-19, should be less than 5% averaged over a 14-day before states, and hence schools can safely open. Do you see that?
I do see that.
And therefore, their recommendation, which we read,
Yeah, so we read that document. We read the document that cited that they're citing that.
Doctor, you gotta let me finish my questions. I won't interrupt your answers, but I noticed
I apologize. You're right.
the prior questioner's question. So let me finish. I'll try to speak quickly and not take too much of your time. Therefore, the FCAAP recommends that school districts in locale with higher positive rates, test rates, more than 5%, that do not meet the 14-day criteria, delay the start date for school until positive testing rates are lower. Do you see that?
I do see that, yes.
Okay. And is it fair to say that these are pediatricians in Florida who actually treat children, right?
I don't know who wrote this document.
Okay. You don't have to take my word for it when I say the Florida chapter of American Academy of Pediatrics are actually doctors who treat children in Florida.
But that's different than who wrote this document, right?
Well, doctor, maybe you want to take a look at the doctor. I'm not trying to be hide anything. It says Florida chapter of the American Academy of Pediatrics.
Yeah, I mean, you're asking me who wrote the document. I don't know who wrote the document.
Okay. It's then let's say it's submitted on behalf of the doctors who treat children in Florida. And would it be fair to say that you simply disagree with their recommendation based on the 5% positivity?
I mean, that they cite the World Health Organization. We read that document. It doesn't say what they say it says. Look at footnote 3 right there in front of you.
Asking you, doctor, I'm really just trying to move on. Isn't it a fact that the Florida chapter of the American Association of Pediatricians, relying on World Health criteria, says that you should have a 5% or more positivity rate before you reopen schools? I'm just trying to get I think it's a simple point.
I mean,
we can move on. The document says what it says, and
I think that there's two questions embedded in that, right? So one is, what does the health organization say? And it doesn't say what they say it says. And then the second question is, they recommend higher than 5%, but they don't provide any reasoning behind that, like the World Health Organization and CDC does, right? And the CDC doesn't come out in favor of 5%, neither does the World Health Organization.
Well,
I mean, okay, these whoever wrote this document wants 5%, but there should be reasoning behind that.
Okay, well, there's a number of pages in it, but we won't go through all those now. You have no reason to believe that there's anything less than honorable about the motives of the pediatricians.
Oh, no, they're honorable.
Okay, and you're also aware that you were suggesting, I think, that, and I was a little confused about it, that children don't spread the virus. I think your testimony actually was that children spread the virus to other children. Is that right?
Yeah, I didn't make testimony that says that they don't spread the virus at all. I said the evidence is consistent with they don't spread it to adults.
Okay. And you are aware of the CDC's own statements on or about August 17th, where they say recent evidence suggests that children likely have the same or higher viral loads in their nasopharynx compared with adults, and that children can spread the virus effectively in households and camp settings. You're aware of that, right?
Okay, so we discussed that with Mr. Stewart, right? So that the viral load is not indicative of infectiousness necessarily, because you have non-viable viral fragments. That's the debate going on in the medical literature right now about that finding. And then can they spread to others, other kids? Yeah, there's evidence they can spread to other kids.
Okay. And in fact, when you were talking about the situation in Israel and Georgia, you were emphasizing that you did not believe there are adequate mitigation measures in effect, correct?
Yeah, I think that's
And we just object, but the whole concept of Mr. Coffey wasn't going to go and ask the same questions that Mr. Stewart asked. And Mr. Stewart not only asked them that, he walked them through the actual document. And we're doing the same thing here.
Judge, I asked like one question because I didn't find that the witnesses' answers were clear, and maybe I wasn't listening closely. But I don't think I'll waste a lot of time.
Go ahead. Yeah, just go ahead with the caveat of try not to duplicate anything that Mr. Stewart covered.
Right. And by the way, Doctor, you don't actually know what kind of mitigation measures are actually being implemented in the schools of Florida, do you?
I mean, I've reviewed some of the documents that about some the mitigation measures in several of the counties, so that's not true.
Okay. Well, let's ask about Martin County, for example. Martin County's been open a while. Do you know what the specific mitigation measures are?
I don't remember reviewing Martin County's particular.
Okay. And you're aware of the fact that virus was reported at J.D. Parker Elementary? That's in Martin County, right?
I was not aware of that particular elementary school. I know that it had been reported in Florida schools or Florida kids.
And I think it's South Fork High School in Martin County. Were you aware of that?
Again, I'm not familiar with particular schools being infected, and particularly in Martin County. I did not review Martin County's data in particular. I've looked at several other counties, though.
Okay. What about Hope Sound Elementary School?
Are you going to keep asking about Mountain County
No.
schools?
Do you win any of those? You don't actually know, do you?
I mean, I did not review Martin County's particular data about which schools and which local. I looked at the plans in several other counties where, you know, it looks like they're taking steps that are consistent with what the CDC says.
Okay. But I mean, you really can't give an opinion about the state of Florida, can you, in terms of mitigation measures?
I can give you opinion about what I reviewed, which is I think Miami-Dade. I looked at Broward. I looked at a couple other counties. The plans that they have in place for some of the mitigation actions that they're doing, which look to me consistent with what the CDC is suggesting.
Okay, so back to Orange County. Do you know what distances they're going to have between the desks in Orange County?
It looks like they're going to have trouble getting the 6 feet in Orange County.
And in general, do you think students are going to be, or have you done any studies to indicate that students will be highly disciplined with respect to observing hygiene protocols?
I mean, I have no information either way. I don't
Yeah.
think anyone really does at this point.
Would it surprise you to know that at least one psychologist who studies the age of adolescence, Lawrence Steinberg, a professor at Temple University, published in the New York Times, says that the plans, he's referring to college age, are so unrealistically optimistic that they border on delusional. Does that surprise you, that the opinion that it's very unrealistic to expect kids to follow strict protocols?
You're talking about college age kids. It's really difficult. I can tell you from firsthand experience, it's difficult to control the behavior, especially outside the classroom. But this is a different question, right?
Yeah. These are kids even younger and less mature, right?
Well, I mean, they're in a classroom setting with teachers that they presumably respect, and in a setting where it's being reinforced to them that it's for their health and for the health of others. It's very important that they follow the mitigation. I mean, can I guarantee that everyone's going to follow in line with everything? I mean, obviously not. But that's different than should you expect there's going to be widespread disobedience.
You talked about a Santa Clara study that you did?
Yes, you mean the zero prevalence study?
Yeah. And were you aware that there was a controversy as to whether the recruitment of subjects for the study falsely claimed that it was using an FDA-approved test and that it would grant the participants peace of mind to know that they are immune. Are you aware of that?
We did not do that. That was an unofficial release by actually, unfortunately, by my wife to her friends. But that was not part of the recruiting material for the study. That's false.
That was sent out mistakenly by your wife. Is that right?
To her friends, yeah, but not part of the study.
And there's another allegation that about funding for the study, and that it was partially funded by JetBlue Airways founder David Neeleman. Are you aware of that allegation?
Yeah, he funded $5,000 to Stanford University after the study was completed.
Okay, so and JetBlue obviously is very much in favor of avoiding lockdowns, right?
I don't know, JetBlue in general. I think Mr. Neeleman is. I don't know how that's relevant to the study. I mean, the study, we completed it after he donated.
Okay.
He didn't fund the Los Angeles County study. I mean, it's $5,000 that didn't fund the vast bulk of the study.
You're talking, and I think I can avoid any duplication, but you were talking about CDC criteria, and I think you're aware of the gating criteria used by the CDC for reopening in general. Is that right? You're aware of the gating criteria?
Can you refresh my? I want to see what you're referring
I
to.
don't know what exhibit it is. Let me just. Exhibit 3, and I'm looking at page 5. I think it's page 5.
I think I read this document.
Yeah, but
You're phase specific, okay.
but it refers to phase 1 downward trajectory for near zero incidence of documented cases over a 14-day period. You see that?
Yeah, for ILI.
Yeah.
I mean, Florida's met that criteria. The ILI rate's been going down for 14 days in Florida.
Yeah, and what were the trajectories on July 6, 2020? Do you know?
You have to go review the numbers.
Actually, the virus was going steadily upward at that time, was it not?
It's possible I have to go review the numbers. July 6th is what, a month and a half ago.
Right.
I think it's going down now over the last I looked, which is
Is it going down in every county, or do you know?
I didn't track in every single county, but the set of counties I looked at, they were going down. The ILI numbers anyways.
Now you have, I believe you said you have reviewed, Mr. Wells asked you a couple of times about you have reviewed the order, the emergency order.
The 06 order, I forget the designation, but yeah, I did.
Yeah. Can we put that in front of the witness? Okay. I just want to go to the second page, Doctor. And going down to reopening requirements, we see the language subject to advice and orders of the Florida Health Department, local departments of health, executive order, and subsequent executive orders. Do you see that language?
I'm sorry, where exactly are you looking? Temporary limited waiver of statutes is necessary to respond.
It's 1A down to the bottom.
Reopening requirements, all school open. Upon opening in August, all school boards and charter boards must open brick and mortar schools at least 5 days a week for all students, subject to advice and orders for Department of Health, local departments of health, Executive Order 2149, and subsequent executive orders. Absent these directives, the day-to-day decision to open or close school must always rest locally with the board or executive most closely. Yeah.
Okay. And in reviewing this document in its entirety, did you see any objective criteria for student safety?
I mean, what I saw was an emphasis on taking into account local conditions, which is exactly what the CDC guidance suggests.
And
And it also says cooperation with Florida Department of Health. I mean, I think the order itself is entirely consistent. I don't think it's spelled out every single detail, as that's what you're asking me.
And would it be reasonable to read the order and conclude that the health departments were going to provide recommendations and opinions with respect to the safety of reopening?
I mean, that of course is a question of local versus state governance. That's different than whether local conditions should be taken into account. This order says local conditions should be taken into account.
Okay. My question, I'm going to say it again to see if you can answer it. Would you agree that it's reasonable to read that language and construe that the Florida Department of Health and or local health departments would be providing opinions and recommendations over whether it was safe to reopen?
I mean, I think it's certainly reasonable to expect that local public health authorities would provide their perspective. Absolutely.
Okay. I've got no further questions, Judge.
Redirect.
Just briefly, Your Honor, if I just have a minute. Doctor, in your opinion, is a preference for in-person instruction consistent with your 20 years of research in public health and with your work on COVID-19 since March 9?
Yeah, in-person instruction is far better for students than online instruction. You can't have, it's very, very difficult, I think, especially for young kids, to get effective learning through online learning.
Is that consistent with the CDC guidance as well?
Now, the CDC very, very strongly emphasizes the need to reopen schools, the benefits of reopening schools, not just for the educational reasons, but also for the health of the students themselves. You've showed the document in the original conversation we had on the schools. The CDC says that for serves at places where social development happens, where nutrition, school breakfast, school lunch happens, for psychological reasons, for a whole host of reasons, it's better to have kids in school than to not.
Okay. And it's also consistent with what the World Health Organization has given on guidance in terms of reopening schools. Is that right?
Yeah, I mean, if you read their guidance, their bias is very strongly toward reopening.
And is it consistent with decisions around the world to reopen schools?
Yeah, it is. I mean, schools have reopened everywhere.
You were asked, I'm sorry.
I'm saying, yeah, so like in places that have seen rising of the epidemic and other places, schools have reopened. In Denmark, in France, in Germany, in Finland, in Spain, where there was a massive epidemic. All through Asia, we've seen the schools open.
And the CDC, are you familiar with their K-1 or K through 12 guidelines for reopening schools?
Yes.
And they provide a menu of things, including wearing face masks, social distancing where you can, sanitizing, and the like. Are you familiar with that?
Yeah, and they say that's exactly what they say. They say you should use mitigation measures to make sure that reopening as safely as possible, consistent with local conditions.
And the experts in the CDC that were writing that understood that they were writing it to the schools going from K to 12, and that those were not unreasonable or heroic types of procedures to use for safety.
Yeah, I mean, in fact, I think if I remember that document, they are specifically talk about how to do it for younger kids versus for older kids. They help us to all of that.
And you think it's unreasonable to believe that these school districts can follow the menu of mitigation factors that are available to them from the CDC?
I mean, it would take a lot of evidence to convince me that any school district in the United States of America is not doesn't have the capacity at all to follow any mitigation in the same sense that so for instance, in the United States, as far as I know, there's not schools with 38 to 40 kids in a classroom like in that Israeli classroom.
Okay.
You'd have to now if you show me evidence that a particular school doesn't have the capacity or doesn't have the funds or something, like really doesn't have the funds, do mitigation, then yeah, okay. I mean, I'll change my mind for that school, but I think you should do it on a case by case basis.
And the mitigation factors aren't necessarily all inclusive, are they? There's a series of different ones that you can use.
Yeah. So for instance, the CDC explicitly recognizes this. So they say, for instance, if you can't socially distance, then you should wear masks. They trade off the mitigation factors to allow flexibility within the schools themselves to say, okay, what's possible, and they look at holistically at it as opposed to one number or one particular mitigation activity.
And based on your years of providing guidance and advice and what you're doing now with COVID, fair to say that it's a risk-based decision whether it's open schools and different policymakers are going to draw the line differently?
Yeah, it's a risk. It's a risk-based decision. There's no other choice. There's no safe option. Keeping the schools closed is not safe. Keeping the schools open poses risk that we can mitigate.
Thank you. No further questions.
Thank you, Dr. Bhattacharya. You are welcome to leave the hearing at this time.
Thank you, Judge.
Call your next witness.
Dr. Hopes should be our next witness if he is able to log on. We've had an interesting.
I think he's in the waiting room.
Awesome.
Okay, and Dr. Hopes, if you'd raise your right hand, please.
Yes, sir.
You swear that everything you testified to today would be the truth, the whole truth, and nothing but the truth.
I so affirm.
Thank you, sir. You can put your hand down.
Tell us your name, sir.
Dr. Scott L. Hopes.
Okay. Dr. Hopes, what affiliation do you have with the Manatee County School Board?
I'm a current member of the school board and former chairman of the board.
Okay. And where are you right now?
I'm in Advent Health Hospital in Tampa, unfortunately.
Okay. Do you nevertheless agree to testify here today?
I do.
Okay. Let's see. Give us your educational. My chair keeps collapsing. Excuse me.
I have graduated from Bay County High School in Panama City. Have an Associate of Arts from Gulf Coast State College, a Bachelor of Arts in Interdisciplinary Natural Sciences with concentration in biology. I have a Master's of Public Health in Epidemiology and Biostatistics from the University of South Florida, and I have a doctorate in Business Administration from the University of South Florida.
Okay. And what is your business?
Primary business in healthcare consulting, company that I co-founded over 30 years ago, serving hospitals, pharmaceutical industries, and internationally.
And what is your experience as an epidemiologist?
I was actually the second graduate of epidemiology at the College of Public Health in 1985 after the legislature gave it degree granting status, and have served as an epidemiologist on assignments in the state of Florida and pretty much around the world. My first what I would say my first big task independently as an epidemiologist is Governor Bob Martinez in the mid 80s appointed me to assess AIDS in the Florida prison system. At that time I had and still do considerable amount of experience in the epidemiology and control of spread of viral diseases. And so really have about 30 plus years, 35 years as an epidemiologist, ranging from chronic diseases as well as infectious diseases, including the SARS class of virus that I was involved in 2002, 2003 with the China Ministry of Health and the World Health Organization's China office.
And have you served in any capacities in the state of Florida in the health field?
Yes, sir, numerous. Worked as a researcher at Tampa General Hospital. And then because of really my data skills back in the 80s, I was promoted to evening and night administrator at the age of 26. I served for a little over around a year in the Ernst & Winnie, then Ernst & Young consulting practice in their healthcare planning and operations practice. I served as the Bureau Chief of Certificate of Need Financial Analysis under Governor Jeb Bush, and was actually the Director of Health Policy under Governor Bush. I teach both healthcare operations, epidemiology, quantitative analysis at Lake Erie College of Osteopathic Medicine, as well as College of Business at USF. I've acquired my first hospital in Destin, Florida in 1994. I've owned, operated hospitals, healthcare facilities, been in the nursing home business. Pretty much my entire career has been spent in businesses around healthcare, health policy, and epidemiology.
Tell us about your involvement with Manatee County School Board. How did that come about?
So I was currently on the Board of Trustees at the University of South Florida, where I had been appointed by the governor and confirmed by the Senate from 2013 to 2017. School District of Manatee County had had a number of issues over the years, including financial issues and some operational issues. And the governor asked me if I would consider going on that board and filling a vacancy and bringing my experience in education, not only as a substitute teacher from kindergarten through 12th, but I had also taught 8th and 9th grade science when I was writing up my research at the USF College of Medicine and Public Health. And so I brought to that the opportunity to have someone that understood the higher education system in Florida, as well as the K through 12 system, and also being a product of Florida's public education system, high school through doctorate degrees. And so I resigned from the Board of Trustees as the Constitution required, and was appointed to the School Board of Manatee County in July of 2017. I was elected chair of the board unanimously in November of 2017, and then ran for election in 2018. It was elected by a countywide vote to a 4-year term ending in 2022.
Let me stop you there. What have your duties been as a chairman and then member of the Manatee County School Board?
Well, it's been probably broader than most would be in that situation. Being the chairman at the time, there were a number of financial areas of concern, which required me to be a little bit more engaged with the superintendent. We had a change in CFOs. It was also widely known that we were on track to have somewhat of a disaster with a $27 million ERP project. One of my areas of expertise is in healthcare IT. And so that kind of, we had a superintendent resign. We only had 30 days to find a new superintendent. And so the interim superintendent and I built a pretty strong relationship in keeping the ship afloat, so to speak. Then when the shooting of Marjorie Stoneman Douglas occurred, had to move in, negotiate with the Sheriff's Department to get officers in. And then, of course, once we had the first case in Florida of COVID-19, which was right here in Manatee and Sarasota County, with that background, I got quite involved in helping and setting policies and operating procedures around that.
Okay, let me break this down a bit. I appreciate you laying that out for me. So you were on the school board, correct me if I'm wrong, when the recommendation came from the Commissioner of the Department of Education to close the schools?
Yes, sir.
And were you involved as a member of the school board in trying to effectuate that?
Yes, absolutely.
Did you have involvement in planning or working to try to figure out how one goes from teaching in the classroom one day to teaching remotely the next day?
Without a doubt, I've been very involved in the whole technology infrastructure growth of the district, which has served us well.
And did Manatee County Public Schools go from in-person to remote in March?
We absolutely did. We had probably one of the quickest transitions in the state, because we had already had implemented a pretty robust electronic platform.
Okay. how long, let's strike that, and you stay close to the end of the school year, all right?
That's correct.
How long after the closure in March did your school begin planning for the next year?
I would say almost immediately. I'm the superintendent, and I had meetings with the county health department director. Knowing that the day was going to come that we were going to have to eventually welcome students back. My experience with this virus is that it was going to be with us for quite some time.
So what did you, superintendent of the Manatee School Board, do to work towards this concept of reopening?
Well, first and foremost, because of the experience that we had in the fourth quarter, we were able to identify areas where we had gaps. During the fourth quarter period, we identified areas throughout the county where internet service was available, but children's families did not access it for whatever reason. So we began purchasing hotspots with service, devices that could be delivered to homes. We retrofitted a number of school buses to have mobile Wi-Fi. And in addition to that, we identified really technology that had to be purchased to give to students. We have many students who just don't have the financial resources to have notebook computers and internet access. So really during the spring quarter, we were already beginning to both plan and test different functions that we were going to be needed to sustain learning through at least the summer, because normally we offer summer school. And so we did find the need to have summer school classes for our students that needed classroom brick and mortar. They needed to be in front of an instructor because they were rapidly falling behind with e-learning.
Okay. Maybe if you can flesh that out, what your experience, what your exposure was, what you saw in terms of student regression as a result of e-learning, notwithstanding those best efforts.
Well, and I think the best example is that critical period from kindergarten to third grade and third grade reading level achievement. And I will tell you, that's the one reason why I determined that I absolutely would take the governor's offer and go to the school district, because in Manatee County, at the time, we had, I think, 53 or 54% of our third graders before I went on the board were not reading at grade level. And so I have been involved in the Suncoast Coalition for grade level reading. And so the biggest problem that we found in the e-learning period during the last quarter is that were those children that were most at risk of both the summer slide, which is where they're not in front of an instructor for nearly 3 months and don't have the resources, do not have a college educated parent at home. And in many cases are living with grandparents. And so we were already seeing that at certain grade levels, especially at the elementary level, the children were not logging in. When we first went to e-learning, we had real high compliance rate with it. And what we found is that indeed what our assumption was held true is those children, our migrant children of migrant families, are Title I students that are living under the total poverty guidelines, that we have to ensure that they get nutrition. Those were the students that were not able to effectively even maintain their academic standing, more or less progress under e-learning. And so we really needed to focus on that. So that's why, I mentioned that we really started planning for how we could reopen schools because we saw, we have worked very hard. Our district, had we graded the district this year, we would have been an A district for the first time in the history of the district. Our third grade reading level had come up, and quite frankly, that had been one of my goals and the superintendent's goals. And so we had to identify how, regardless of this pandemic, we were not going to lose the gains that we had achieved for these children.
Stop your narrative now and try to move a little bit. So during the period of time in March, April, when you're working on the remote learning, were you also evaluating how you might ever go back to in-person
education?
Yes, absolutely. Absolutely. As I mentioned, we've been working closely with the health department in identifying how we could minimize the risk of infection and get these children in the classroom. And we tried it out in the summer. We had
When
small
did you
classes.
start? When did you
Pardon
start?
me?
When did you start that planning on, okay, what do we need to do to come back safely?
I would say probably late March, mid-April.
And then you talk about testing it some in the summer. How did you do that?
We did. We actually identified, as I mentioned, students that were at the greatest risk based on their prior performance and based on, you know, their status with regards to compliance and logging in with e-learning. So we had a number of elementary schools and some middle schools where we brought in small cohort students of 10 or less, a teacher. We had a mask policy and additional precautions. Teachers were wearing masks and shields, and this is long before, you know, reopening the schools this past Monday. And we had a plan coordinated with the health department on how we would deal with screening these students. So we actually had, I want to say, probably 400 students in small cohorts in a number of schools in the district this summer to get them in and get them evaluated and continue their learning in brick and mortar, because those students were not learning at the rate we thought they should be under e-learning in the prior quarter.
Did you leverage that any in terms of trying to look at opening up brick and mortar for a broader group of students?
Oh, absolutely. I mean, that's what it was for. You know, in planning, planning is great. You put it on paper, but you really don't know where you may have missed something until you put it in action. And a perfect example are the parents that said, "Oh, our child won't be able to wear a mask." We've got videos out there. In fact, it was on Good Morning America of young elementary children that were able to wear a mask in a classroom the entire day.
Did you have a program or a project around the mask education?
We absolutely did. We, you know, and I can't remember the date, but it was around the time that the commissioner issued the executive order. We had a survey that we developed with the health department and the school district to survey parents to determine what did the community want, parents, businesses, with regards to opening schools. And an overwhelming majority of respondents, over 21,000 people, responded to the survey with a number of questions. But over 21,000 people responded, and a majority wanted schools to open 5 days a week in the fall.
And how did you and the school board, the school superintendent, move forward to figure out if you could do that in a way that would be safe for your teachers, your staff, and your students?
As the CDC began to put out guidance for schools and reopening schools and operating schools, we worked with the director of the health department and her team. Because of that response and because of the guidance at the time, we felt that we could minimize the risk of spread of the disease, and we actually leveraged the community's desire to open schools to come together with a Mask Up Manatee coalition, which included the health department, the school district, and the county. The county passed a resolution on mask and social distancing, and we laid out that campaign. And so we got the community to actually come into compliance with CDC guidelines in preparation for opening our schools on August 17th.
So you mentioned the emergency order number 6 that we're here about. How did you receive that? I mean, I don't mean how did you get it, but what was your reaction to that order?
Well, you know, the initial reaction when I read the first paragraph was a little bit of shock. Commissioner Corcoran's a great friend of mine, but then I stood back and I read the entire document, and I read it twice. And really, I got to say, I found it to be, you know, artistic and brilliant at the same time, because it made clear what we already knew as a district in analyzing our students' performance, that we really did need to be able to offer 5 day a week learning in our schools in front of an educator. And it also allowed for the localization and to work with the health department to figure out what worked best for the community. So we saw it as guidance, and we also saw it as being in alignment, with our own thinking of the needs of our students in Manatee County. It provided for options. It provided for parent choice. And so that's how we began to finalize the planning that we had done for our three modalities.
And when you say your three modalities, what are you talking about in Manatee County?
Well, Manatee, the modalities that are aligned with the CDC's guidance, the most recent guidance in August 11th, where the lowest risk to the school population is e-learning. Moderate risk is what we referred to as the hybrid model that we developed, where students would be in class 2 days a week, 3 days online. And the highest risk are those students that are in the school's brick and mortar 5 days a week. And when you look, let's take the highest risk. In creating healthcare policy, and this has a lot to do with healthcare policy, and as I mentioned, I was the director of that for the entire state of Florida. You have to measure risk versus benefit. And with regards to the 5 day a week option, as I discussed, we identified a very significant population of our students, our learners in Manatee County, that the benefits of being in a classroom in front of an educator, getting the nutrition they need, because they rely on us for breakfast and lunch, and to have that contact with the school for not only academic development, but also emotional and emotional development as well. And so that's what we found, that indeed the July 6th order provided us with that level of flexibility, and so that's how we built the plan.
Okay. Did it provide any flexibility with respect to funding?
Yeah, it did. I mean, we found with the CARES funding and other funding that as expensive as it has been in doing this, so far it looks like between our reserves that we've been maintaining because of our financial health and the offer, I will tell you, I don't know how many, I think hundreds of thousands of masks and other PPE supplies that we've gotten from the state, as well as the federal government, to help us implement our plan with regards to adequate, personal protective equipment for both our educators as well as our support personnel and students. Our schools ordered 2 masks for every student, ordered face shields for students. We used our technical college to help us build plexiglass and acrylic barriers so that we could create built-in splash guards for students to maintain a separation. And so in actually putting to test the July 6th order, we discovered that we were able to build a very robust plan for reopening our schools. I think we were one of the first to apply for approval of our plan based on our own board's approval, and we did receive approval by the commissioner to move forward and implement our plan. And August 17th, we did just that, and we welcomed back over 50,000 students in Manatee County.
Well, let me ask you this, but before we get to your actual plan going out, did you do anything as you and the superintendent school board were pulling these ideas together to involve your parents and community and your teachers in trying to understand what might be the best thing to do?
Absolutely. As I mentioned, we had the survey. We collected a tremendous amount of data from that. Our strategic planning committee, including the superintendent, went out and met with community leaders, community members, church leaders. We have a pretty strong coalition of pastors that represent their communities, and we really built this as a community, as I mentioned, and that was critical, because without the community coming together in support of that plan, and also in support of the Mask Up Manatee, I did not feel we would have an adequate chance of success. But we found that the community, when they were engaged at all levels, including parent-teacher organizations, and educators and retired educators that wanted to help, we were able to really bring things together, in my opinion.
How did you involve your teachers in this process and make sure you were
At multiple levels? We obviously started with Pat Barber, who is the director of the Manatee Education Association, our local teachers union, and she was very much, including her board, were very much an integral part from the beginning of developing our reopening plans, and we had their support.
Okay. Did you do anything in terms of live instruction plans to work with your school board members and help them understand what was going on?
Oh, we did. We had numerous workshops, which, of course, while being electronic, they were delivered through our numerous platforms to the community. All of our workshop meetings were on 2 different cable companies delivery, live on the internet, and then we recorded all the meetings for the community to be educated at the same time as the board was being educated. We had the director of the health department and her team come to the board for a workshop where we brainstormed a lot of this in public.
Did you avail yourself of any of the resources from the Department of Education?
Yes, we did. We did. Throughout the entire process, and the Department of Education had frequent calls with superintendents, and at times I participated in those calls. We have a board member that is assigned to the Florida School Board Association. The Florida School Board Association had numerous workshops and conference calls with school board members. So while the Florida Association of School Superintendents FADS was having their workshops, the Commissioner of Education and his chancellor had workshops with superintendents. And so it was a multi-level approach to ensure that we were covering as many of the bases, the board, the policymakers who are responsible for allocating the resources to effectively implement these plans. So it was, as far as Manatee County was concerned, I felt that we brought together all the partners and parties that were needed to successfully reopen schools, but more importantly, to keep them open.
Okay. Did you do anything to manage your response to the COVID-19 pandemic?
I'm sorry.
Terrible question. I'll do it this way. Did you establish the District Operations Center?
Yes, we absolutely did. As part of this, and being an epidemiologist, early on, we had non-healthcare individuals identifying our quarantining and self-isolation. And so we were fortunate with our relationship. We opened a command center. The Manatee County Health Department, part of the state's Department of Health, assigned a full-time epidemiologist to us that is housed and based at our school board office. The health department gave us the director of the school nurses for the nurses in our county. Half of the nurses are employed by the district, half by the health department. So we had an exceptional nursing, a practitioner resource, as well as our attorney risk manager and our health and safety directors are all in one location with social distancing in the district. And that command center receives information from the health department, and they give information to the health department. So when the health department, independent of the district, through their contact tracing, identifies a student that's part of the family, we get that name immediately. And we also implemented electronic sign-on under our school buses. So when we get information from the health department that these children of school age are in families that have a positive case, when that child scans their ID on the school bus, we know that child should not be entering school. And in fact, we've already had the experience on Tuesday with being able to capture, in essence, and identify a student that is at risk because of contact based on the health department, and we were able to contain that student. Each school has an isolation room for that purpose, and we're able to minimize that student case contact with other students. Likewise, when we get notified from any one of our schools that we have an employee or a student that has symptoms, it gets reported to the command center. The command center, having the epidemiologist from the health department right there, immediately does contact tracing and determines the next course of action.
These measures that you've done in terms of working with the community, working with the Department of Health, the DOE, and your teachers, is that something that only Manatee County can do? I mean, in your opinion, is that something that can be done by each of the school districts?
I think it can, with the resources. I think Manatee County, had a head start. I'm there, so I knew to anticipate this stuff. Never in my dreams did I ever think that when I decided to focus on education, did I think that this experience would have the impact that it's had. But no, I do believe so. Now, each county is going to be different. There'll be different resource needs, but absolutely what we have seen, because now we've had the opportunity at numerous stages from spring break all the way through summer school and testing our strategy and with the opening week. We're now in day 4 of opening. I think we're probably one of the largest districts in the state to reopen our schools. And I have to admit, I've been surprised myself. Even from the hospital bed, I get reports, and the superintendent and I speak multiple times during the day. And I can't be more proud of our district, our community, our parents, and our students.
What has been the reaction of your teachers, parents, and students to the reopening?
Well, based on the reduction of the emails that I've been getting, the board members were, of course, bombarded. Of course, we had teachers that were concerned. I understand that. We have teachers that are at risk. The superintendent and I and other board members, we all went and visited schools and talked with teachers and talked with principals well before this opening to get a better understanding of both the climate and the culture, and also for reassurances. And especially in some of our special needs classrooms, I personally worked with the classroom educator and paras to number one, better understand the virus, better understand how it spreads, what their risks were, and how we could minimize that risk, just as if they were a worker in a hospital.
What have you done, if anything, to work with and try to accommodate teachers that this may be a problem?
Well, I think I would say the best example, I had received an email, all the board members received the same email from a teacher that teaches in the I and D classroom for the intellectually developmentally delayed, and I immediately realized from my experience with cerebral palsy nursery that we needed to give this teacher some attention. And so I went, I had a conversation with her by phone, and then the superintendent and I went together, and we walked through her classroom. We had a talk with her about her children. And Your Honor, just to put it in perspective, in this classroom, this is a K through 5th grade classroom, and the children in that classroom are functioning developmentally and intellectually at an 18-month-old to a 24-month-old level. These children, are pretty much still in diapers. They need assistance in learning how to eat, and so that time in that classroom 5 days a week is critical for these children to be able to reach their greatest potential. We came up with a plan that teacher felt safer with regards to going all the way down to the level of clothing, to provide scrubs with laundry service, so that she had a fresh clothes to wear when she's teaching, that are comfortable, that fit the work that she and her teacher's aide does. And then she can take those clothes off in a separate room, take those shoes off, and when she leaves the school and goes home, she knows she's not taking anything with her. And that was important to her, because her 66-year-old mother cares for her 3.5-year-old while she's at work, and she has a father that just finished chemotherapy for cancer. And that made all the difference in the world to that teacher, to know that we've given it thought, that we brought in some expertise, and that we're there to meet her needs, because she really wants to be in that classroom for those children.
Did you do anything to provide additional training or additional time for teachers to train to get ready for this opening in this new world?
We did, and that was based on the communication level that I think our board has with our classroom educators, and our response was to actually push the start of the school year from the 10th to the 17th, and use that additional week for additional in-service and training for our teachers and staff, but as importantly, to do the most that we could to use that opportunity for teachers to identify potential problems and work with the administration to develop solutions. And so a lot came out of it. And that extra time, we were able to also share with all of the staff, more importantly the teachers, what our disinfecting protocols are, what materials we're using, what happens when their classroom is fogged at night, with regards to basically decontamination or the like. So it was valuable.
Thank you. In your view, as a board member, was a mid-August return important for your students?
It was, and I'll tell you, I mean, that's one of the reasons why I pushed back with regards to pushing it out any further. First of all, 2 or 3 weeks with a disease like this, with a virus, it was not going to make any difference. And what was critical for us is remembering that these children had not been in front of a teacher, had not been in a school for almost 180 days, I think 177 days, that they have not been in a school. They have not had contact with a teacher. The teachers did not even know what level they were at and what happened over the summer. So we felt it was important, and I certainly strongly feel that we needed to get as many children into the schools as possible to evaluate where they were academically, emotionally, and developmentally, and as important, to identify what are their needs at home with regards to technology. We bought additional 1,000 hotspots. Where do we need to deploy those hotspots so those children have access to the internet and the school's information systems? And take a family of 4. In order for them to participate, even if they're in e-learning or a hybrid, they all have to have devices, because they're all going to different classes at the same time. So I don't know how many tens of thousands of Chromebooks and notebooks that we purchased, inventoried, and had ready on the first day of school to issue to those students. One of the biggest reasons is Labor Day weekend. Memorial weekend, we saw a surge in cases 2 weeks after Memorial weekend. 4th of July weekend, saw a huge surge in cases that went on, and is still going on. Labor Day weekend, if people let down their guard, and we have to intermittently transition students to e-learning for a short period of time, we will now be prepared, because they spent these 2 or 3 weeks before Labor Day weekend being assessed, being put in the right classes, the right courses, assigned to the right teachers, and we've sent them home with the materials they need to continue their learning in that environment. And I was convinced if we did not do that before Labor Day weekend, we would be in a situation where we would be at the level we were at during spring break, which was not the best. That was an emergency situation. This is not an emergency. We've had time to plan.
And do you have protocols in place to deal with checking students out as they come back after Labor Day weekend, checking staff?
Absolutely. And we do that today. All staff have to go through a checklist in the morning, a series of questions that are from the CDC guidance to help assess, whether they possibly could have been exposed, and they have to make an attestation. In addition, we have an assessment tool, a screening tool for students, and it's already proven to be helpful. And so every day, all students, all employees in the district go through this basically daily survey, which is really an evaluation of risk before they actually enter their job site or their classroom, and that will be the process coming in after Labor Day as well. Everything from have you traveled, et cetera, so that we can, as I said, this is all about nothing's risk free, but we can take a number of steps to help reduce that risk so that our children can continue their academic progress.
Let me put up, can you put up the master plan, please? To get you to identify the 2020-21 Florida Optional Innovative Reopening Plan for Manatee County. Are you familiar with this?
Yes, sir, I am. I think I voted to approve it.
And this is the plan that was the result of all the work that you've talked about.
Yes, sir.
And it provided, I think you told me, 3 separate options for education.
Yes, 3 different options, modalities.
And have you had parents that have selected each, or in other words, there are students that are in each modality?
Yes, sir, there are.
Okay. Can you pull up Exhibit 25? You can put that down and pull up Exhibit 25. And did you, in your group, prepare information lists on your district operations centers and then flow charts and checklists to be available for the parents and for the teachers?
Yes, we did. I think this is for the district operating center. Absolutely.
We're going to scroll down. This goes on for several pages of documents and just keep going. And I'm just going to ask you why all this was put together.
Well, first of all, it was an important communication tool, but more importantly, that's kind of like the heart and the soul of our overall strategy and operating guidelines to prepare for and safely open our schools. And if we follow these guidelines, we're going to be in the best position to continue operations throughout this pandemic.
And I put up back to school checklist for parents and students. What is it and why did you go about doing that?
It's a little bit different from years past, I have to admit. Again, it's all communication, and it's also an education piece. And so that in putting it in this kind of format, it already gets our parents and our students thinking. Each principal was assigned the responsibility for reaching out to every parent before school started and to go through this information with them.
You can take that down. Let me conclude this way. You told us a few minutes ago there's no risk-free way of dealing with going back to school in this COVID time, correct?
Correct. Yes, sir.
And do you believe that the plan that you have put together and you're implementing is the best compromise between in-person education and the risks associated with COVID-19?
Yes, sir.
Okay. Let me ask you this. Are you going to be, or are you set up to continue to share your work on a webinar for all school districts?
Yes, absolutely.
Okay, and so we'll be sharing the same information that's out there. Okay.
It is. And I know a number of districts have solicited from the superintendent and have been talking with her about it to use it as a model in their district.
Okay. Thank you. No further questions, Your Honor.
Let's take a 10-minute break before we start with the cross on Dr. Hope's.
Thank
Courtney, recess for 10 minutes.
Thank you.
Oh, let me turn my thing off. Tired. Whoops, about to turn it off.
Okay, good luck, sir. Okay, now I think that's officially the last one. See y'all tomorrow.
See you tomorrow, Your Honor.